participate in procedures that they have religious or moral objections to. In March of this year, the administration published a notice of proposed rulemaking in the Federal Register that would rescind a Bush administration conscience protection against discrimination of healthcare providers who did refuse to participate in abortions because of religious or moral objections to the procedure. We asked the President today to follow up on his commitment made to the country and to those who were at the commencement of Notre Dame to withdraw the proposed regulation and to protect the conscience protections that the Bush administration wrote into the Federal Register. The President has said that he wishes to be an administration of choice. We call on him to respect the choice of those healthcare professionals who do refuse to participate in abortions and not to use the power of the federal government to force them into choosing between their profession or their religious or moral faith. This is in the true tradition of American religious freedom. The pro-life healthcare providers do have conscience rights. Those rights ought to be respected, and the President ought to withdraw the proposed regulation so that they cannot be discriminated against simply because they hold firm religious and moral beliefs against abortion. Now I'm happy to introduce Congressman Chris Smith, who has co-signed the letter with me.
Thank you, my friend and colleague. Let me just say a couple of things. When President Obama this past weekend said he believes we should honor the conscience of those who disagree with abortion, all of us said, great. Nowhere is this more important than in the medical profession. However, just 2 months ago, the President's actions to repeal the very regulations that would enable the medical community to honor the conscience of those who disagree with others on abortion was a major step backwards on behalf of the President of the United States. I think, as you know, over the years, Congress has passed several laws to respect and protect the conscience of LPNs, nurses, people in the medical community, OBGYNs, so that they would not have to engage in the killing of unborn children. Unfortunately, those regulations are not often well understood by many in the medical community. Not only that, they're very often not implemented at the local level. The regulations that were promulgated by the Bush administration are very clear, they were precise, they were not ambiguous, and they sought to empower individual people at the local level, in hospitals and clinics across the United States, to exercise their conscience rights. When President Obama pulled those back and suggested that they would be eviscerated, that was a major step backwards. We've gotten some renewed hope, hopefully it's not false hope, over the weekend, that he will look to boldly and aggressively implement regulations. So our hope would be that he would reissue those regulations, allow them to stand, and even strengthen them. So I thank you for coming out. We're calling him to live up to his word.
Thank you. I'm Congressman John Fleming from 4th District of Louisiana. I'm also a family physician, been practicing medicine 32 years and have been pro-life. Continue to be pro-life. Just in the last week or so, this Congress passed a bill, the so-called hate crimes bill, that protects many, even those with sexual disabilities, perhaps even pedophiles. And so what we're asking the President to do is to similarly protect healthcare workers, nurses, physicians, and others who need the same sort of protections that anyone else would need. And this also, we hear from the other side where there's all this talk about choice, mother's right to choose. Well, what about the healthcare workers' right to choose? Today in hospitals and other facilities, a physician or a nurse or other healthcare providers could be forced with the pressure of losing his or her job to participate in some way with an abortion. And that's why it's so important that we leave in place President Bush's very specific regulations that do protect the healthcare workers. And I'll say parenthetically that I penned a letter about a month ago, and there were over 100 signers as well asking President Obama not to rescind President Bush's regulations. And after hearing this speech at Notre Dame, we do want to more or less hold his feet to the fire, that indeed if he feels that this is a matter of conscience and healthcare providers should be allowed to act upon their conscience, that he be good for his word. Thank you.
We'll now take your questions.
Do you have, Dr. Fleming, of the people that you had signing your letter last month, do you have any others that would come forward and support this effort? Have you talked to any other members of the conference, or?
I've not had the time to do that. I mean, this came up too fast for me to have a chance to visit with them. But the sentiment among those who signed the letter, I think without question, 100% would be willing to support this.
Let me say that since we got back late yesterday, we think it is very important to send this letter to the President immediately before people forgot what he said at Notre Dame relative to upholding conscience protection. This is a test on whether the Obama administration will do what the President has said. The President was very clear in saying that he wished to respect the consciences of those healthcare professionals who have moral and religious objection to abortion. That should mean that his administration should withdraw the proposed rule to rescind the Bush administration regulation that prevented employment discrimination against pro-life healthcare professionals, because that's the bottom line on whether there is protection for conscience rights. The Bush administration did this. In March, the Obama administration proposed to repeal the Bush administration regulation. I would hope that the President would direct Governor Sebelius, as Secretary of Health and Human Services, to withdraw the regulation proposing the repeal and to reinstate the conscience protection that the Bush administration put in place for those healthcare professionals that do not wish to participate in abortions.
And this should be very clear. Our view isn't that President Obama has repealed the laws. There are 3 major federal laws that protect conscience, but without implementation, they become not worthless, but less valid in terms of the implementation of the sentiments contained in them. So we're saying, without regulation, without a robust effort to exercise the right of conscience, which Americans have, medical personnel have, and the regulations give voice to that, it becomes a law that is very ineffectively being implemented. And there has been, and you've got to know this, it's a matter of fact, NARAL and other groups have been trying, they tried it in Maryland, for example, to use every means possible to coerce the healthcare professionals all to fall into line with abortion promotion, so that at some point, medical practitioners, from doctors, OBGYNs on down, will self-select out of being involved in any way, directly or indirectly, even as an anesthesiologist, with maternal health care or OBGYN type of services. Because why? Because they are also then compelled by a hospital or a medical clinic to be involved with abortions. There are many, many examples in many states where discrimination has been practiced against healthcare providers. And that would also include Catholic hospitals in toto, not just individuals. So there's a major effort to get everyone to conform. Back during the Clinton administration, there was language that we actually got language into a bill, the delay amendment, to overturn as part of a graduate medical education. As a prerequisite to becoming an obstetrician, obstetricians would have been compelled to actually do an abortion. That would have self-selected out every pro-life obstetrician in the country. Doctors are told how to do it. Under that proposed rule, they would have been compelled to do it. And we would have had a country filled with pro-abortion obstetricians who do abortions. And that would have led to, I think, a serious shortage, frankly, of obstetricians. because so many of those individuals, men and women, turn out to be strongly pro-life.